Another much awaited session for the day, in which we have our speaker, Dr. Jagdish Chaturvedi. Dr. Jagdish Chaturvedi is an ENT surgeon, medical device innovator, author, and a stand-up comedian. He trained at St. John's Medical College and Hospital, Bangalore, and trained in the biodesign process from Stanford University. He holds an MBA degree in entrepreneurship and hospital management as well. He has co-developed and commercialized, licensed out 9+ medical technologies over the last 12 years. He is recognized as one of the 35 innovators under the age of 35 by MIT Technology Review in 2016. He is presently the founder and CEO of a healthcare consulting firm, High Innovations Private Limited. He is also a practicing nose and sinus surgeon at Fortis Hospital, Bangalore. He also features in a medical comedy web series in medical innovations called Starting Trouble, streaming on Amazon Prime, US and UK, and YouTube channel Buddy Bits. High Innovations Private Limited is a Bangalore-based healthcare company registered in the year 2018. The core aim of High is to empower and support the involvement of healthcare professionals such as doctors, nurses, paramedical, and hospital personnel, and medtech entrepreneurs or startup companies in the development of innovative healthcare solutions for India, with a goal to promote Make in India and Make for India healthcare solutions. So I would like to invite Dr. Jagdish Chaturvedi to take the session forward.
Yeah, hi everyone. Hope can you see me here? Hello.
Yeah, yes, we are able to see you.
All right. Are you able to hear me well?
Yes, clearly.
All right, guys. Hi. Thank you for the kind introduction. I'm here to just talk about, using this IP Day, how you can take your ideas forward. Though I come from medical technology and healthcare background, I guess the principles apply almost everywhere. But I like to do this talk very differently, okay? Because honestly, I don't think just giving a PowerPoint presentation and then, you guys dozing off and then would be doing justice. I want to keep this interactive. And I'm going to really today share 5 reality checks or innovation hacks to tell you what can make your idea successful. Now, before I start, I want to just get a quick sense. How many of you over here have an idea that you want to take forward or interested in being an innovator or an entrepreneur? You can say yes on the chat window, or you can put a thumbs up in the gallery. I'm able to see everyone over here. Yeah, so many of you, and many of your doctors I see are saying yes, you have an idea, you want to take it forward. All right. Can someone tell me, and you're welcome to unmute yourself and answer, do you think inventing a new idea in India is easy? Does anyone think it's easy to do that?
Jagdish, I think you'll have to rely on the chat box because
No.
otherwise there'll be a lot of confusion. So I think they've muted everybody. Yeah.
Okay, no problem. On the chat box, I see that some people are saying, yes, it is easy. So most people think it's easy to develop a new idea in India. And what seems to be the problem? We are not really the leaders in, okay, now you're getting to see some no's. The moment you question the yes, the no's come. Easier to chew glass and stare into the abyss. Wow, very nice. Not easy at all. Inventing idea may be easy, but protection of the same is cumbersome. I see. Not easy in the Indian context. So why do you think it is not easy? Any particular reasons why people struggle, especially in healthcare? We still import about 80% of our medical devices. And that's what I think is one of the root causes of our healthcare problems, because if we import very expensive devices, then hospitals charge high to patients and we get beaten up. That cycle keeps continuing. So lack of innovation. Okay. Some people say that there is very little process knowledge about patenting. Yes, to develop idea, but difficult to commercialize. Idea has to be commercially viable. I think a lot of you feel that it's easy to come up with the idea, but then taking it all the way appears to be difficult, right? Awareness, lack of governance, all of the thing. Easy to invent, but getting into practice and protecting is challenging. I see a lot of protection coming. Lack of clarity on regulation and mental blocks. Yes. Okay, guys. So I'm going to share. I've been 12 years into this space. I'm a doctor. I'm not, someone who ventured out to become an inventor. I had to do that because of my personality trait, and second, because of the situations I was in. But now I've been involved with about 18 devices. I have 9 products in the market. I've just launched the 10th one yesterday. I'm going to talk to you about it towards the end. And there are basically 5 things that go wrong, I feel, either an expectation mismatch or just like you said, lack of understanding of the process. There are basically 5 things that I've seen very, very commonly as a pattern amongst entrepreneurs that they misunderstand, because of which they struggle to take their ideas forward. And I'm going to share those simple, 5 hacks with you. The first thing is that most people believe that some ideas work, some ideas cannot work. Would you agree with that statement, that only some ideas have scope for impact, whereas some don't? The Indians are not hands-on with simple tools, drills, saws, makes us illiterate in terms of engineering. Okay, that's one. See, I personally believe no idea is a bad idea, and no idea is there's no idea which you cannot take to the market. I'll give you one example. It's my favorite example. And has anybody heard of this app called Yo? YO? Anybody heard of this app called Yo in your lifetime? Nobody? Some people are saying no. No. All right. Yo is a very interesting app that was developed about 10 years ago. And do you know, can you take a wild guess what this app does? This app, you can select anybody from your contact list. Yeah, similar. Yo-Yo Honey Singh has got more substance in this. Hear me out. You basically select anyone from your contact list and send them a yo, and they receive a yo notification on their phone, and they send you back a yo. This is actually an idea from some software developers in the Bay Area to make this social media platform called Yo, which basically has a simple thing. It has a button in the middle that says Yo. You click that Yo, it goes to your contacts, and everyone receives a Yo. They click that Yo, and you get the Yo back. That's all. And you might think that this is a ridiculous idea, but this was valued at $10 million, received Series A funding, and grew to be a very popular case study. Can you guess how Yo got to that valuation? There were more than 1 million users of Yo. Yeah, there's a yosocialmedia.com. Okay, somebody's also put that. There are millions of users of Yo. It got investment as well. It got valued, and you might easily argue that anything else that you do has got more benefit and impact, which doesn't get any funding, doesn't get users to use, but this did. Can anybody take a wild guess? How did that happen? See, I think in healthcare or anything else, I think every idea has a potential to reach the market and create some impact, even something as ridiculous as Yo. The problem is what it takes. Yeah, like someone says, Charush is saying marketing. What it takes to get it there. There is always a cost of time, money, and resources for any idea. And if you have the right amount of time, money, and resources, you can take any idea all the way to commercialization and even create impact. For Yo, the founders spent $1 million to get their first million customers. They basically acquired a customer at $1 per acquisition through their marketing, through their promotions, and all of that. The moment they had 1 million users, investors, they're like, oh, 1 million users must be something. So, they invest for the database, for the brand, for the potential for it to grow. And it got valued at 10 million. They were able to raise around and grow it. Eventually, they had to stop it because how far could Yo go? But they were able to take that idea from to more than 1 million users. The problem is how many of us have access to those kind of funds. We don't have $1 million lying, in our banks and all of that. And the problem with healthcare is that when you're going to invent something, you also have this ethical pressure of getting there quickly so that you can save more patients. But at the same time, you want to do it properly. You don't want to undercut anything so that you don't risk other people or do no harm. And I think that's where the challenge lies. I mean, honestly, in India, if you have 50 lakhs to a crore to your disposal, you can basically take any idea to a fairly decent extent, where you can, be pre-commercial or even have a launch of a product and be in a good position to start generating revenues and generate funds. But many of us do not spend 50 lakhs to a crore, or we don't even have that kind of money. And that's why, especially for something like healthcare, which is not a single domain expert field, it's very hard for one person to do everything. Like if you're an app developer, you can always think of an app. There was somebody citing, a very successful, prolific entrepreneur who had, many patents in the engineering field. So if you're a single domain expert, you can think of novel ways in your own field. But when it comes to healthcare, unfortunately, to invent or create something, it cannot be just a single person's abilities over here, because doctors understand only the healthcare problems, but we don't understand technology very well. Technologists understand the technology well, but have not much idea about what exactly to do. IO is an India competitor to Israeli-based Yo app. There it is. So Yo also got copied. Okay, to become IO, and I think that's what everyone would say. Yeah, but to my point, in healthcare, where you need multiple people to be involved in taking your idea forward, and not having access to funds, it becomes very challenging to solve. And that's why I think it's important to work on something that is necessary, something that is a need, something that is a requirement. And that's where I think we struggle with healthcare, because it's very hard to understand what is the requirement in healthcare. Most people are inventing based on their personal healthcare experiences, or somebody has suggested something, some doctor in their family, or some bad experience they've had. Seen so many entrepreneurs saying, my parents had a heart attack, I want to do something for quick detection of heart attack. Or somebody had a stroke and they found it hard to manage bed sores, and they went through that. Most of the times, I think I would say a good 60% of entrepreneurs out there are working out of personal experiences or close suggestions. But very few are working on actually understanding what's really wrong and what needs to be solved with the greatest impact, because not all of us have funds, resources. I think you lost me there for a second. Can you hear me back?
Yes, now you're audible.
Okay. Okay. So can someone tell me what is the last thing you heard so that I could repeat that? I think I was out just for a few seconds.
Yeah, I think you were talking about entrepreneurs taking up the problems. 60% of them were by their own experiences. Yeah.
Yeah. But very few startups or healthcare companies or entrepreneurs, that they work on ideas that they understand. And there is a process. There are many people who follow a lot of processes, but there are good processes out there that you can use to actually understand what's wrong, what's the unmet need, and how to solve it. And I personally recommend that you follow a process which validates the problem. And even though you may have experienced something or somebody gives you an advice, use that as a starting point, but do not directly jump into a solution. The problem I see, I have also experienced this, but I see this a lot amongst entrepreneurs, is that, we kind of invent like falling in love. How love happens. You just see something and then pyar ho jata hai. And then, after that, anybody who stops you is basically the villain. So similarly, we see a problem and we immediately get an idea, hey, I just do this and it will fix it. And then that becomes like, your love for the idea. And then you just want to keep protecting the idea. Anybody who says, hey, I've already seen that product, it's useless, you're useless, everything you do is not going to work, you just become a little more angry and antagonistic, and try to do that. And it's not natural or intuitive for us to take a step back and evaluate, because sometimes you're also evaluating your own abilities, right? And we usually, just as Indians, are not very okay with sometimes accepting that we're not done the right thing. And a process is going to show a lot of loopholes to you. It's going to show a lot of things that you assumed that were not the right way to go. And it takes a lot of maturity to do that. And I think that's why I think we are still maturing as an ecosystem. We are way better than what we were about 10 years ago. I'm definitely really thankful to that. Like the Pune Venture Center and so many things that BIRAC, DBT, DST have done, such a better ecosystem and much more understanding towards innovations. But for me, it was an eye opener, because when I was at Stanford University learning how to invent, I was in a meeting with this gentleman called Dr. Thomas Fogarty. I don't know, the non-doctors may not know him, but most doctors know that he invented the Fogarty balloon catheter, the one that you put inside the clogged blood vessels of the heart, to basically dislodge those clots. And a lot of our angioplasties are based on that fundamental principle. And we were to meet him as a part of a tour, and the meeting that he was having with his new startup was basically asking why they haven't failed or gotten anywhere wrong. They seem to be making very good progress, and that was a concerning red flag for them, saying that they haven't failed yet, and they fear that once they launch into the market they may fail. And that was a whole genuine concern for them to see, are they playing it very safe, are they skipping enough risk management processes? Why is it that they are not, their technology is not failing? Because then it can fail once it's out, and that has happened. We've had J&J recall a lot of devices. We have had phones explode in planes, and many times, you can do more damage when failure happens when you're commercial, if you don't really test your device or subject it to so many environments before that, so that it can fail early, fail fast, and fail cheap. And we're building to have that kind of insight towards failures, but that doesn't really intuitively come to us. Dr. Prakash is on Yo as well. Yo could have been used to communicate symptoms. Yeah, during the pandemic, of course. Yo, are you okay? If there's no Yo back, that means Yo is not existing. So the first thing that I would say is, no idea is bad idea, but select a need and an idea which you think will be able to get you the funds, resources, and time. If you want to work something that purely you think you believe and other people don't, then please try to make sure that you have enough funds to take it to the next level. And you always have Yo to compare yourself. I don't think it could get any more vaguer than Yo. The second problem that I've seen a lot now is, we get very infatuated by other things. Now with Shark Tank and all coming, we all start picturing, why am I working as an employee? I could also be running my own enterprise and working on my own ideas. So many of you said yes. And it looks attractive, when you look at the success stories. Failure stories don't come out as much. And I think there are these three categories of people that I find. And it's important to know which category you fall under before you take your idea forward. One is the wantrepreneur, who wants to be an entrepreneur but does not know how. And you'll find a lot of these. In fact, for someone like me, people reach out to me from all over the country almost on a daily basis. And the majority of the people are wantrepreneurs. Sir, I want to invent. I don't know how to invent. Please guide me. Just guide me. I don't know. I don't know even what to do next. I don't know what to work on. I don't know how to work on it. I don't know how to take it forward. I want to be a successful entrepreneur, but I don't know how. You have made yourself successful. Please tell me how I can be successful. Please guide me. These are entrepreneurs. Most of us don't even know how to respond to them, because you just can't generally just guide someone on WhatsApp or on a phone without even knowing the person. True guidance usually happens when you work with someone over a period of time. But entrepreneurs want to be entrepreneurs, don't know how to be entrepreneurs. Then there's a true entrepreneurs. And I know this is a fancy French name. Can anybody here write down over here what really entrepreneur means in your mind? Yeah, Avnish, I'll answer your question in a bit. How does Israel's healthcare innovation differ from India? Yeah, if you have any other questions, keep putting that in. I will respond to them. What do you guys think is an entrepreneur? Risk taker. Okay, good. That's one way to look at it. Any other? Can I get a couple more people defining what they think an entrepreneur is? Doing something of your own as an entrepreneur. Okay. Problem solver. Pratik says problem. So how is an entrepreneur different from an innovator? Business builder looking at future opportunities. Yes, Premnath saying that. Commercialization. Okay. So he commercializes the invention as an entrepreneur, somebody who comes up with the idea or the so-called novel technologies, the innovator. See, generally, one who takes financial risk, yeah, I think getting a lot of those answers. Innovators are at an idea level. Yeah, so most of you are right. See, an entrepreneur is a person who takes financial risk with the hope that it will give them, sustainability and benefit going forward. So by definition, a true entrepreneur is not going to be asking how to get started, because a true entrepreneur is already started on their own. They're usually the kind of people who are stuck somewhere in the process. They've already developed something or partially developed something, and they're going through the hit and try route. And they're usually reaching out to ask for solutions to get out of that, optimize their process. I have not seen anybody who is a successful entrepreneur ever ask anybody how to get started as an entrepreneur. They just eventually started because they wanted to, they had that in them, they took the risk, and that's why they got to actions. They got to doing some things, and they're just stuck at different stages, and they're looking at ways to get out of those stages or improve themselves from. And yeah, like compass approach. So there are a few entrepreneurs, and many of us want to be entrepreneurs, or we are entrepreneurs, but we are not true entrepreneurs. And the third one, the most annoying, are the haunterpreneurs. They haunt the entrepreneurs and anything that supports the entrepreneurs. They're the ones who will quickly tell you why your idea is not worth anything, why your idea already exists somewhere else and they have already used it and it was not good, or why they should not be doing. They're basically full of excuses for how not to be able to do what they want to do. And I've had a fair share of entrepreneurs, and really don't know how to manage. It's a need that we can solve, is how do we manage entrepreneurs effectively, because they do have the energy to be fixed on something but not be able to do it effectively. So are you a person who is interested in an idea but is always seeking for a way to go forward, or are you a person who is contemplating how to take an idea but always having excuses of why you can't? Or are you someone who's already started off and you're looking at how to get to the next stage? If you're the one that I just mentioned, then you will eventually get there, because if you're an entrepreneur, you'll keep taking risks, you'll keep trying something, and you'll keep progressing and getting there. But asking how to get started is typically a very risk aversive approach. You're being very, very concerned about every decision you take, every step you take, whether it's right or wrong. You want to do it the perfect, exact right way. Unfortunately, in the field of innovations and in the field of creating a new idea and a new opportunity, there is no set way. There's nobody, even I or anybody else, can tell you the right way. You have to figure it out yourself, just like everyone who has made it has figured it out themselves. Nobody has had the exact same approach, and nobody has really followed somebody's approach and been successful. People sell their approaches after they become successful because it's a new business idea for them. They can write a book about it, they can give talks about it, and they can grow their network with it. Honestly, I don't think by following what somebody says you really get very far. And that's why what I'm sharing today in these talks are very precise insights, so that you can think and understand whether you fall under that bracket or not. Very important to know whether you really are an entrepreneur or not. And if you're an entrepreneur, you will be in some of the other problem right now. And that is the true test of being an entrepreneur. If you have avoided that problem, you're not an entrepreneur, you're a entrepreneur. If you've caused the problem for someone else, you're a entrepreneur. So that's a very easy way to diagnose these three things. The third insight I'll tell you of why, it's actually not very difficult to invent in India. I saw a lot of people say that, it's hard to commercialize, hard to take it forward. I am right now in this interesting phase where I get a lot of young startups and young entrepreneurs saying, I have a great idea, but nobody's investing in it. At the same time, I have so many VCs. I have sat in panels for a lot of DBT grants, DST grants, and a lot of VC network, investor network were saying, Jagdish, we're not finding good startups to invest in. And I'm like, here, there are many startups who are not getting funds, and there are many investors who are not getting a startup to invest in. What's going wrong over here? Why is this gap there? It's not like there is nobody to invest and people are not getting funded. It's not at all that way. And if you can see off late, the kind of funds that Indian companies are raising, it's tremendous. 45 million, 15 million, $20 million. It's a huge amount of funding. There are funds out there. There are a lot of people who want to fund great technologies, great ideas, groundbreaking solutions, but they're not finding many people suitable for it. At the same time, there are hundreds of these so-called entrepreneurs trying to start something but not getting funds. Can anybody take a big guess what is wrong? But like why, like somebody said, need more bridges. What is the bridge over here? Can anybody guess why it's so hard to get funding? Someone who can talk. Mismatch of expectations is, yeah, absolutely correct. Pradnya is saying that. What are the expectations that I will share? Properly communicating the idea, process, communication. Yeah. Valuation. I'll tell you a very easy way. Somebody said mismatch of expectations, product market mismatch, and someone who can talk both languages. You can talk both languages too. The thing is, we are usually stay on one side. We don't try to understand the other side. Even though we talk so much about empathy, being in somebody else's shoe, understanding the problem, understanding the need, we always think that is only from problem solving for the product point of view. But actually, if you go into every step of the innovation journey, you need to understand what the other person needs, even if they are a particular supporter or an investor or a partner or a clinical trial partner or a patient, right? You have to understand from both sides. And a very easy way to understand this bridge, the funding bridge, is that if you can take some amount of your money, even if it is 10,000, 15,000, 50,000 rupees, and go looking for a startup to invest in them, you will understand what the bridge is. Because you will realize that what you expect from an investor or think that the investor expects as a founder or an inventor, it's very different thought process when you are looking to invest in someone. Because yeah, is that idea adding value? Charushi is also asking. Because when you're so immersed with your idea, you're so immersed with your technology, the impact that it can create. I've seen some entrepreneurs making their pitches. We are the best, we are great, we're going to be able to do this, and all of that. All they have is a PowerPoint presentation on a pirated Microsoft Office. But the things they say are so grandiose that many times they think that is what is going to get an investor excited. In fact, the investors almost having a sort of a panic attack listening to those things, because they're very far from reality. But when you try to invest in someone, you will be surprised that the technology or the idea really doesn't even come in the top 2 or 3 things that you're looking for. Because when you invest in someone, it's very simple. There's nobody who does a course of investment. Somebody has funds. You could also have funds. You all have funds, actually. You have some amount of money that you can give to help another startup. So technically, everyone can invest. The problem is we don't know that, and you don't try that. And part with 50,000, 1 lakh rupees for a change. Just do that for a startup in goodwill. Take a small equity or whatever it is. Get them to the next stage if you can. Don't give them any support in kind. Okay, put the money there where you feel that you can help. and then really evaluate the thought process of why you invested in which company. And I'll tell you the things that an investor looks for, because I have done this both sides. I've received funding, have also invested. And as an investor, Avnish is saying, I want to see realistic numbers and returns. And as an innovator with vision, I just want money to realize my vision. That's very true. In fact, realizing your vision is making you blind, because you want the funds to take you to the next stage, but an investor is not. So like when Avnish is saying that you want to see realistic number and returns, realistic is very important. And some of the unrealistic mismatches that inventors have is, and if you're trying to invest in someone, you'll probably first look at the team. You will look at the credibility, the realisticness, the ability, and the reliability of the team. Because honestly, if there's an idea sitting on the table and I throw money at it, it's not going to move from the table. There has to be a capable set of minds and hands to take that idea forward. And the biggest concern with anybody with their money is, what if it stops midway? What if these are college students? They have a great idea, they're smart, they're energetic, but at the drop of a hat, they'll go for an MBA abroad and then take photograph from there and put it on LinkedIn with thousands of likes. What's going to happen to your money? What's going to happen to the support that you are giving, right? A person with money, you may think that if somebody has money, then I can just give it away and I won't mind it being lost. No, there's a lot of moral and ethical responsibility, because that fund, if it goes in the right hands, you're doing justice. But that fund's going in a place where it's not going to do anything. You're depriving some other team that could have used that money better, because of your wrong decision. You didn't evaluate the team properly. And many times, when you are investing, you very much want to see whether the team is good. And if you look at anybody who's made good rounds of investment, the teams are solid ground teams. They're not teams who have just sacrificed their jobs and times. They've, put in a lot of skin in the game. They're there for the journey of the product, and that reliability is there. The second thing is that reliability does not come overnight. I see so many people come for pitching rounds and they immediately want funding the next day or within a week or month. So impatient. Try to invest in someone. You yourself will want to see them for 3 to 6 months to see whether they're having any growth, whether they are, taking your suggestions, or whether they're open to suggestions. How are they? Putting money in a team is not short of getting into a relationship. It's someone, you're making a big commitment to, and you want to know those people, right? And there's a reason why arranged marriage doesn't work all the time. You have to understand each other's chemistry. And similarly with investors and startups, there has to be a lot of understanding and connection, and you then only can trust your money, with them. So do expect at least 6 months to 9 months of knowing each other. And that's not only from the investor point. You should also know who your investor is before committing to that investment. Otherwise, it could be a very harrowing experience if your investor does not have realistic expectations, and then you are basically not going to progress, because most of the times you'll try to just keep your investor happy. And that is not a cycle that you want to go in. So that 6 months to 9 months of engaging with a potential investor is very important both ways. And it does not mean that there is delay in funds, or you are not good, that's why they're not closing their eyes and just putting it the next week. It's very, very important to spend that time. Very, very important to understand the team, and very, very important to understand the capabilities before you can invest. So executing team who has put the skin in the game and a lot of understanding are very important. So Dr. Vanita says. So personality profiling and all is also very important. So have those expectations. Entrepreneurs will want the fund right away. When entrepreneur will want, to assess and look at opportunities. And entrepreneur will use the funds for their salaries and move on. So now the third thing, and this is a very standard flaw that I see out there, is people come and say, I have a great idea. It's going to be phenomenal. It's going to be groundbreaking. Please put in money in it. And then an investor will ask, how much have you put in your phenomenal idea that you have come up with? People will say, not much. I'm only putting time. I quit my job, putting time, putting effort. That is equal to money. No. How much money have you put in your own idea? How much money has your friends and family put? If you suddenly want to do something abroad, ridiculous amount of funds show up. People put in 25 lakh, 50 lakh for their, education, sometimes up to crores in medicine. People study post-graduation in management college putting a crore and a half for a radiology seat, and all of that. And they are able to pull that funds from loans, from friends, from families. But when it comes to their groundbreaking, impressive idea that is going to change the world, not put any money, and want other people to put money. You tell me in which logical world is that going to work out? And then you're going to say that there's very bad investment phase in India. Are you as an investor going to invest in someone who's not invested in their own idea? You're not. It's the first thing that you're going to ask. If you yourself don't put in money in your idea, your friends, your family who know you for your whole life do not trust you with their money. Why is an investor or a third person who you just met in a conference and took a photo at the end, going to put in any money in you? They are not going to put in any money in you. That's illogical to expect that. Okay, so typically, if you are a true entrepreneur, you will put as much as you can, and you will stretch as much as possible to get your ideas far, and you'll be struggling to move it to the next step. And that's where investors, partners really want to help some teams like those. But those who are, playing it too safe, just selling their idea, selling a great story, but not really putting in enough, and you can see that they're really not putting in enough that they can. And they just want funds, and everything is subject to the funds. If I get the funds, I will do this. If I get the funds, I will take it to the next level. If I get the funds, I'll do that. If there are no funds, there is no progress. For an investor, that's very important. If there are no funds and there is no progress, you technically are not really a risk-taking entrepreneur. An entrepreneur is going to constantly figure out ways to take progress. I have about 19 ongoing loans on my name, and I'm basically unloan worthy anymore. But that's how much of kind of, I've taken overdrafts, taken personal loans, taken corporate loans, taken money from friends and family and parents, been removed from the will, all of that, because you try as much as you can to support your idea. 50% of them have failed. You're willing to take that risk. The other 50% are getting somewhere. They're getting you somewhere. So you really need to be that profile, and you cannot really be that. You have to just know whether you are or not, because it's going to be very uncomfortable for you to be someone you're not. If you're not comfortable with risk, and you're not comfortable with your money and your family and friends' money, then you're probably just better off doing whatever you are. You may want to be an entrepreneur, but if you're not, it's good to know that. And that it's just an important thing. Okay. Now, the fourth one I'm going to talk about here, and this is kind of related, is a lot of people worry about being copied, their idea, the patent being, I know this is World IP Day, and I heard a lot of things about in the music space, in the app space, and all of that. Well, I agree. I agree in places where the copying time is very small. This IP protection is extremely important. But when it comes to healthcare and comes to medical devices or technologies, the whole development itself is so expensive and so time consuming that honestly, you think if you're going to spend 2 crores and put in 40 people to copy somebody else's idea, that's, you might as well just partner with that person, right? It's not very easy to copy something that's technologically complex and all of that. So in my experience, when it comes to healthcare and medtech, I really haven't seen too much of this copying happen. And even if it does, generally, I would like to clarify this notion. If you're the only one doing something, then everybody around you and you yourself should be skeptical as to why you are the only one doing something and nobody else is doing that. Because if you look at every successful product, there's always 1 or 2 other players. Like if I say Uber, you'll automatically say Ola, you'll automatically say taxi for sure or something. Or if you say, Amazon or Alibaba, or if you say Myntra or Jabong, or, if you say Big Basket or Grofers, or if you take anything for that matter, you take the number of phone companies that are out there all having very similar features, just a little bit of here and there. Anything, Intel, AMD, typically, there are 2 or 3 players that need to capture the market. You share your marketing risks, you share your branding and all of that, and you basically capture the market. It also validates that somebody else has also independently come up with that idea. The first time I invented, when I came to know there were 2 other players in the market, I was shattered. Now, if I invent something and there are no other players, I am shattered, because I'm like, am I doing something or missing something? Absolutely. Because how is it that nobody has thought of this, and what is it that I'm missing about it? Because having 1 or 2 other players is actually quite important. Investors also look at that way. Like, it's very simple. See, the putting in money in something that you don't know whether or not it will work, is a very big risk for the investor also. We're like, hey, Uber was successful, no, so Ola will also be successful. Like the same model, no, Oyo Room and this thing, it's same. Like, then the little more risk averse investors will be like, yeah, it has already worked once. It will work again, but to a lesser extent. And eventually each one will cannibalize each other or eat each other, Myntra eating Jabong and then somebody eating Myntra and then Flipkart eating this, that keeps happening, like Byju's is like a typical eater out there, just eating any other thing and just growing, because after a point of time, you can't create, so much, but you have funds, you can just buy out technologies, and those kind of exits, like my technologies itself have been licensed out and bought out. And eventually, that happens as well. So don't be so worried about this protection and all of that. And even if it happens, it's such an elaborate process to even execute something. Like, see, in India, our license trading in healthcare, medtech, and like I had filed a patent in 2010, which was granted 2 years ago. I stopped the commercialization. The whole market closed about 5 years ago, right? Like Elon Musk has bought Twitter, right? Yeah. So yeah, that kind of thing. Sometimes it takes very long to get your patent. Sometimes it takes very long for you to even sue someone, especially in this space. It may happen quickly in Western markets, like in the US and Europe. You get your license also fairly quickly, and the trading is a very standard thing. Like many people want to enter the market, there is an approach to buy the license, right? In India, very few people have that approach of buying the license. It's shunned upon. It doesn't look innovative or creative. Or why you want to take a license and develop that? And some entrepreneurs like, yeah, why do I spend 5 years or 3 to 5 years developing the technology when I can immediately license, manufacture and sell, and immediately capture the market and create a healthcare difference, right? Because we want novelty, we want the innovativeness, and then that becomes a very important rate limiting step to go forward. Otherwise, हमको नहीं करना है, हमको unique ही करना है, and अगर कोई ऐसा, if somebody is making something similar, तो हम उसको बदलेंगे so that we have that uniqueness. But it's okay to have a couple of common players. I mean, at the same time, don't go in something where there are 10 other players. Because out of those 10 other players, if 8 have done well, you'd probably do fairly well to be bought out by one of them. So I think this assessment and worry about IP protection, especially in healthcare and medtech space, I think is a bit over projected. It's important. I definitely recommend that when you have any idea, you should definitely file a provisional, get the priority, file the patent, freedom to operate, and all of those PCTs and all of that, so that you have a good opportunity to scale and grow. But it should not be a reason for you to not take your idea forward. I did not get, we filed patents and we didn't get it for at least 5 of my products, but they still were able to commercialize. We had freedom to operate, and we were able to, still reach the patients, because the real question is not whether the solution exists elsewhere. It's whether the solution is absent from the place where the problem is. If you are in your hospital and the solution is not reaching you, it's definitely not always the affordability. There are a lot of other reasons why it's not there. Could be maintenance, could be spare parts, could be accessibility, could be a lot of those things. You are solving for it, even if it's in a less innovative way, it's still saving somebody's life. And there is a business for it, there's a sustainability for it, and there's an impact for it. And we need to start thinking about it in that way and work towards quickly solving problems in an effective way, rather than always seeking novelty, which is very, very hard to do, especially in the medtech space. Yeah, finally, someone had to say it, and that's why this is a very frank, direct conversation. And the last point I'd like to share is that, and this is something that I learned the hard way, is the team is more important, and in chronology, the team has to come before ideation. It's not intuitive, what I'm telling you. Normally, one person gets the idea and builds a team around them, but that is kind of a DNA towards struggle and failure. And I'll tell you why. One of my early inventions, I came up with the idea and I started finding an engineer who could develop it, a product designer who could design it, an MBA person who could market it. And I could never change it in their mind that this is Jagdish's idea, we are working for him. This is Jagdish's idea, we are helping him. So when it is Jagdish's idea, they expect something. Okay, now whether they have shares or whether they're going to expect some sort of funds, whether they're going to expect a contract deal, they will only work as long as Jagdish is going to make them work or provide them what they need. It's very, very hard for someone else to take that onus like I am taking, because the process started from me, and then I built the team around me. And I see so many people, solopreneurs. These solopreneurs are just, they're like, like stag entries in bars and pubs, just looking for partners, looking for the right team. They have this beautiful idea, but they just don't have anybody who can help them take it forward, because this is a dynamic started off with them having the onus of it. And when we studied many successful startup companies, when you have a team first, let's say, and you must be wondering, how does one do that? How does one have a team and then come up with an idea? How do you know you're going to get an idea? So the way to do it is, let's say I have an idea in the pediatric space. So what I will do is I'll first find potential engineers and designers who want to work in the maternal and child health space. Even though I have an idea, will not share that idea. We'll just say, are you interested to do something in this space? We'll take the team and spend time with them in the maternal child health space, maybe observing patients, hospitals, interviewing doctors for a month or two, and have them also come up in the ideation process and see whether my idea falls anywhere, what they're doing, and then pitch it in later on, and then collaboratively come up with an idea or a solution that the team has come up together to solve that particular problem. When you do that, and when it's with the team's idea, then even if Jagdish is not able to take it beyond a particular point, there will always be a team to take it forward. There's better investment for teams. There is more onus for each one, and there is a better trajectory. And that is what I've been able to do. I'm a fully practicing doctor, but I've worked with so many startups because there's always an engineer designer duo along with me who has co-invented and co-developed a particular solution. So we were able to create an entity. We were able to get funds. I was able to stay with my clinical domain because then it became very easy for me to shuttle between the problem and the solution areas and bring the product in and test it, validate it very quickly by being in both places internally. And I think that was the formula that allowed me to work on multiple devices quickly. If I was a solopreneur and just looking for teams, it was going to be very challenging. So these are the 5 points that I wanted to share. And you have any questions, I'm happy to answer it. I have a couple of product examples that I can give as well. Do we have time, or maybe another 10 minutes?
Yes, we do have.
Yeah, so I think while you put your questions, I'd like to share a couple of product examples. Okay, so I'm just going to quickly share my screen. Yeah, are you able to see my screen here?
Yes.
So I follow a process called biodesign. I just want to quickly show you, this is a simple product. It's not really a very big product, but I just want to show you what a process takes to follow it. I also would like to put out a disclaimer that the video that I'm going to show you is going to be slightly disturbing, involving a child who's in pain. So if you are sensitive, then for the next 5 minutes, you can refrain from watching it and you can come back and watch the rest. But otherwise, the rest of the case study is fairly straightforward. Okay, move this away. So basically follow this biodesign process started by Stanford University in collaboration with India, called Stanford India Biodesign with AIIMS in IIT Delhi. We follow this principle of identifying with the team first and inventing sequentially later so that you have a better chance of the team going forward. And we usually have the team which is a cross-disciplinary team of an engineer, doctor, product designer, and a business person or a scientist, spend a lot of time in the hospital. So we were doing this about 10 years ago in some rural hospital in northern India. We were basically observing a lot of the emergencies and the hospital facilities. We were visiting some rural areas. And then we came upon this actual observation, which we got permission to record the video. I wasn't there, but my team was able to record this video because we had divided ourselves into 2 teams and we were looking at different things. This doctor wanted to actually demonstrate how he is solving this particular problem. But unfortunately, we were able to record a failure and a potential unmet need. What we typically do is we find about 400, 500 of such problems, and we use a lot of strategic filters to arrive at the top 5 or 10. And one such observation would look, like this. Okay. So here's a video, viewer discretion advised.
The observation was a 5-year-old child who taken a button off his shirt and is stuck in the nose. This case was seen at a community healthcare center, and because of lack of tools, they do a jugaad to create, a small hook or a bend by bending needles.
This 5-year-old child put a kind of a button into the right nasal cavity. Very common for me as an ENT to see these kind of situations in the hospital. The engineer and designer who were doing this observation were seeing this for the first time, and this doctor was basically talking about how they take a needle, like a simple syringe needle, and he bent the tip, and it was a tool that he has used successfully numerous times. However, in this demonstration, it didn't work. They eventually brought the child to me when I was in the other hospital. We removed the foreign body. We thought it was a one-off thing, but when we spent 2 months, we found about 40 of such incidences happening in the rural areas. And then when we started doing the research, we found out that there are over, I think about a few lakh cases of nasal foreign body impaction that happen. So when we started doing the epidemiology research and started interviewing a lot of doctors, visiting multiple hospitals, we recognized this was a bigger problem. And the real gap over here is that for an ENT like me, I have the training with our tools to remove these foreign bodies quickly. But the problem is these children are not in places where ENTs are easily accessible. They are at a place in a rural part where parents are both daily wagers. The children are left alone. They're playing with pebbles, stones, seeds, and all of this. They may have some allergy or itchiness. They might put things in their nose and it will get stuck. If it goes into their lungs, it can be very dangerous. And the first point of care doctor is an MBBS doctor or a pediatrician. They are not trained in endoscopy or tools. So there was this very clear gap that we were seeing, that the people who can remove the foreign body are not the first point of care. And at the first point of care, if it is not removed, it ends up in a more severe surgery. And we thought that this could be a problem that we could solve. And since this was already observed by us as a team of an engineer, designer, and a doctor, it was everyone's ownership in developing this technology. So we started doing some, what we follow in this process is after the need filters up, we do some concept screening and selection. So what I'm going to show you now is a small cadaver study that we did exploring different things. And as a learning perspective, I thought we just put a suction, just put suction in the nose and suck out the foreign body. And I was really strong with that idea. We fall in love with the idea. I was like, yeah, suction use karte, it'll come out, right? But the engineer was like, it's not always easy to get suction. You might not get a seal and all of that. But I was like, no, I'm telling you, I'm the doctor. But when we did the cadaver study over here, again, viewer discretion advised, cadaver shown but blurred. But we tried all these kind of approaches to remove the foreign body to test what we finally were able to make. It was actually a simple handheld device, and this is a doctor who actually purchased the device and used it, and actually then independently posted this on YouTube, showing how successful removal through this device called Nosino, which is a nasal foreign body device. So as you can see, this is the actual usage by a doctor on a patient when the device was commercialized. And it takes a few seconds as the handheld device passes it behind the foreign body, pulls the trigger, and this peanut is out. They found out there was another foreign body on the other side of the nose. Again, passed the little probe into the nose, and it pulled it out. The device is now in over 500 hospitals across the country, and so far we have not had any report of failure of removal from this device. Goes to show the validation and the process of developing the technology. So I find out what the world needs and then go and try and invent it. So that's basically the case study. Similarly, it's always important to keep understanding problems and solving it. Right now with the pandemic, there's another potential problem that we face, especially as doctors and also patients, is that we are now not very open to going to hospitals and getting examined. Now, what happens to an ENT field where everything that we do is nose and throat? We have to look inside the ear, nose, and throat, but now majority of our patients are online. And now there is also a lot of portability that is required. So the new particular product to solve this problem is to allow for tele-examination. And this is a product that we just launched yesterday. It's a soft launch with about 100 ENT doctors, basically to enable ear, nose, and oral cavity examination remotely. So potentially I can look inside your ear, nose, and throat setting from here using a wireless device that we basically provide to you. Just like Swiggy and Zomato delivers your food, or labs come and take your blood test, we send this device with a technician who can quickly examine your ear, nose, and throat for us to complete an examination, and can also be used portably for camps and emergencies and all of those things. So this is the device.
The high-tech two-ear ENT tele-examination device is a portable, handheld, lightweight, wireless device that connects quickly to your phone and gives you high-quality endoscopy images of your ear, oral cavity, oropharynx, and the anterior part of the nasal cavity. This device quickly connects to your wireless phone and can be used to examine patients in your outpatient clinic, in your post-op rounds, in the hospital, can be provided to patients for post-op assessment at their homes and remote examination of patients from their homes in different cities, and also for conducting rural camps for quick examination of the ear, nose, oral cavity, and oropharynx. You can order a device by scanning this code or visiting our website www.hi.in.
Right, so there's a couple of examples of, one is an old product, this is a new one, and we're constantly inventing to solve problems as we identify. That's the end of the talk, ladies and gentlemen, and thank you for being patiently listening and very interactive. There's this one question over here that was asked, by Dr. Prakash, is can you give a glimpse on a noise cancellation device for tinnitus? This is a problem that we tried to solve but failed. And the reason for failure was because of poor scientific understanding of the condition tinnitus. Tinnitus is a condition in which when your hearing nerve is injured, your auditory nerve is injured, the injury is causing, a production of certain ringing sounds or fluttering sounds. The patient is constantly hearing a ringing in the ear, but there's nothing outside. And because of which they're not able to concentrate on work, they're not able to sleep, and they're not able to carry on. We thought that we could have a noise cancellation device which will do kind of a phase shift and cancel the noise. But what we did was we were able to do this in 100 patients and cancel their noises successfully, but only for a matter of a few hours before the brain kind of adapted and changed, the frequency and amplitude, and there was a new kind of tinnitus that started appearing, and our device was not able to identify the change and change it constantly. So it was a very complex scientific process that we eventually had to abort because we in the field of science itself do not understand how tinnitus works. And this is very much at the level of the brain response system and not so much about just canceling the noise. So for that reason, we could not take that forward. But that's it, guys. Thank you. Another question was Israel versus Indian health tech ecosystem. See, the thing with Israel, and we've interacted with some Israeli entrepreneurs and some people from their ministry. Their organizations, their institutions, and their investor network fuel in high-risk funds to a lot of ideas, and they particularly work on not simple improvements but groundbreaking ideas, and they funnel in a huge amount of funds. There are a lot of such problems, even like the tinnitus one, which is scientifically very challenging. There are a lot of genomic, biotech, in cancer research, regeneration, a lot of these things that take many years to develop, but require millions and millions of dollars of funds, which our ecosystem is not ready to fund in something that is so potentially a big question mark to achieve. And even if it does, it may take many decades to get out. Israel is able to procure the technologies to fast track and develop such high-end, products and funnel in millions and millions of dollars and take that risk as a country and with its ecosystem. And I think that is why they work on more cutting edge technologies and they're able to take it forward. We are getting there. So we already have a lot of funding opportunities available. But even though they're at that 50 lakh, 1 crore, 2 to 3 crore market, it still is good enough for us to get started, build that ecosystem a little more stronger. There are, IITs and ISCs that are working on cutting edge technologies, but we need to be able to get that out of the institutions in a faster way. And countries like Israel or other countries, have a system to bring technologies out from institutions in a much more faster manner. I can give you an example, with DBT and even with IITs. If you have developed an idea within the institution and you want to make a company, they basically sell the IP back to you because the IP is owned by the organization or the institution. But they sell it back to you at very nominal royalty, which is less than usually 1 to 3%, which is fair because then, the team that takes it forward, who's basically going to develop and fund or raise funds going forward, have enough, for the investors to take. But I've seen some IP cells and some innovation cells in so many colleges that have ridiculous 60%, 80% royalties. I mean, I can't see how the idea is going to get out of those institutions, and why would any industry or investor invest in just 10 or 20% available for them. So sometimes I think we have to realize that 100% of nothing is nothing, and a 5% of something huge can be tremendous. And I think there are many organizations and science institutes and IITs that are understanding that. And most of these countries like Israel and the US and all of these places, institutions are very favorable exit for their ideas or the technologies to the industry. And it aligns with the industry because it takes a lot of money, time, and resource to get an idea to commercialization. Whereas an idea, though it is important, it cannot go beyond without that effort. And for that effort, the industry has to own majority to get that forward. Otherwise, the cycle is not going to fit. So that's what I'd like to say. We also have planned an interesting short quiz towards the end. Okay, last question. Your comments on innovators and entrepreneurs staying calm in troubled times. Is it important to be positive and generally have a good sense of humor? Your videos during COVID relief, any words for startup? Yeah, see, I mean, thanks for that. But see, if you are not facing problems, you're not doing enough. I mean, if you're a startup and you are comfortable, there's something fundamentally wrong with what you're doing. Because as you're trying to create something new, you are disrupting or creating problems in a new solution. See, there's a lot of behavioral resistance, both from the users, end users, and the society when something new comes. We are all not comfortable with new things. We are not all comfortable with change. It takes some time for us to adapt to it. So every startup is going to face resistance, is going to face challenges. You're going to get newer insights, but that's really what's going to plug into solving and making a more sustainable solution. So I think that if you are facing problems, you're facing challenges, then you should be rest assured that you are moving forward in some positive direction. If you're very comfortable as a startup and you really have no problems, then I think there is something big that is just going to come towards the end. So don't be upset if you don't face problems. Rather expect them, and that's your job to mitigate and face those challenges, and that's what's going to make you and your ideas more robust. Well, does IIT collaborate for realization? Of course it does. IITs have a very robust exit strategy, especially IIT Delhi and Bombay. Other IITs are still gearing up. IIT Hyderabad is also doing quite well when it comes to technology exits. I think IIT Delhi has already commercialized a few technologies, and I think they have very reasonable industry terms for that. What is your advice to clinical doctors who don't want to be medtech innovator but would like to work with a team doing that?
Dr. Chaturvedi, just one request. Can you take this as a last question, because we have one more event as a last session?
Yeah, sure. So this will be the last question from Charushri. Loved entrepreneur. Okay, kudos. So for doctors who would like to be associated, the best way to be associated is to yourself as an innovator stage. And if you're an innovator, you can have an innovator pool for royalty in the beginning, which is usually a 1 to 3% pool that the founders or the pool of innovators keep for innovators, and you can put your ideas there, and or you can also work as consultants for a contract fee, and you can also be clinical trial partners along the journey and hold this kind of royalty or some small amount of shareholding or an ESOP plan with startups. So there are many ways to engage. With that, guys, thank you very much. And I was very happy that this was an engaging talk. And I look forward to meeting you sometime in person, and all the best for your inventions.
Yeah. So, hello all. I'm Vinita from Venture Center, and on behalf of TechX, I would like to do a pleasant job of vote of thanks to Dr. Chaturvedi. So thanks, Dr. Chaturvedi, to make us understand and all participants that no idea is a bad idea, but identifying the unmet needs, especially in the healthcare domain, which needs a multi-domain expertise, is very, very important. Thanks for sharing with us your experience in Stanford University regarding testing of device. And finally, and the most important part is how to get paisa to support your idea. So understanding the chemistry of the investor and the innovator is very, very important. And to create enough of the understanding between the team and the investor is also very important. Another important part, what you have shared, is accepting the